Good evening, everyone. Thank you for joining us. Hopefully everybody can hear me all right. If you can't hear me, please raise your hand or something. Looks like we only have people joining us online tonight. So again, I appreciate you taking the time out of your day to participate in this training or this presentation. As usual, we'll go through the presentation. I will pause at intervals to see if anybody has any questions. When I do pause for questions, you're welcome to unmute and ask your question, or you can raise your hand, or you're welcome to type a question into the chat at any time, and I will address any chat questions during the pauses. Hopefully everybody got the email. Looks like you did. So we'll go ahead and get started. So tonight we're going to be talking about Medicare drug coverage. This is part 3 of our 4-part Medicare 101 series. As usual, just a little bit about who I am with and what I do. I am at the Pikes Peak Area Agency on Aging, and the mission of the Area Agency on Aging is to work with our partner governments in our 3-county area of Pikes Peak, El Paso, Park, and Teller counties to develop programs and systems that help people stay in the community for as long as possible. I am the coordinator for the local SHIP program, or State Health Insurance Assistance Program, which is an advocacy program that helps people understand Medicare and anything associated or related to Medicare. Every county and every state has access to a SHIP program, at the very least by a toll-free statewide number. And again, we are consumer advocates. We are here to educate and advocate and assist people in anything related to Medicare. We do a lot of Medicaid assistance. We can talk about Social Security. So if you have any questions, you're always welcome to reach out to us. I've provided our local toll-free number, statewide toll-free number, and our local Colorado Springs number. This program does cover a total of 9 counties in Colorado, and all 9 counties can contact us through that local Colorado Springs number. Just a quick word about the program. In the email that I sent out earlier today, it did include a survey, a PDF fillable survey. We do appreciate you taking the time to fill out those surveys because they do make a big impression when it comes to funding at the federal level for this program. If you have any questions or you need that survey provided in any other format, please let us know. Just shoot me an email. Quick review of what we've covered in the last 2 weeks, our first and second classes. In week 1, we talked about original Medicare parts A and B, eligibility, cost, coverage, all that kind of stuff. Last week, we talked about insurance that's available for anybody and everybody to go with original Medicare A and B, and that was the Medigap or Medicare supplements and Medicare Advantage plans, also known as Medicare Part C. And we talked about enrollment periods, eligibility, and that kind of thing. And of course, this week we are going to talk about the newest benefit of Medicare, which is the prescription drug benefit, or Medicare Part D. D is for drug. So as I mentioned, this is the newest benefit of Medicare. It's only been a part of Medicare since 2006. Prior to 2006, people with Medicare had to pay out of pocket for any and all medications that they needed, unless they had drug coverage through some other sort of drug benefit or health benefit, say through retirement coverage of some sort. It only covers outpatient medications, so it only covers drugs that the doctor gives you a prescription for, and you take that to the pharmacy, and the pharmacy fills it. If you're receiving medications in a hospital setting or a skilled facility setting during rehab or something like that, that's covered under different parts of Medicare. The Medicare drug benefit is specifically for pharmacy prescriptions. Medicare drug benefits are provided through private insurance companies, very much like the Medicare Advantage plans we talked about last week. So these are companies that Medicare contracts with directly to provide this coverage and act on Medicare's behalf. So even though you are enrolling or paying for a drug plan through a private insurance company, that is considered your Medicare benefit. So there are a lot of plans to choose from. I think this year we have a total of 13 or 14 individual Part D standalone drug plans. And then we also have the drug coverage that's available through all of the Advantage plans. Each of the drug plans has its own individual formulary or list of drugs that it covers. And you always want to make sure that your specific medication needs are covered by any plan that you enroll in, because every drug formulary will be different. For standalone Part D plans, you do pay usually a separate monthly premium. There may be deductibles. There will be copays at the pharmacy. And there is financial assistance available for this specific benefit of Medicare as well. And we will talk about that as we go through the process. So, as with all parts of Medicare, the first question you should ask is, should you enroll in Part D? As with all parts of Medicare, it is optional. There's nothing that says you have to enroll in any part of Medicare, whether it be A, B, or D. In order to enroll in a Part D plan with Medicare, though, you do have to be enrolled in at least one other part of Medicare, so A or B or both. You may not need a drug plan through Medicare if you have the option of having a drug benefit through other means. And other means could be you have a retirement health benefit that coordinates with Medicare that includes a drug benefit. You access the VA pharmacy benefits. You're still actively employed, and that employer health group health coverage includes a drug benefit. So if you have what they consider creditable drug coverage through other means, such as employment or retirement health coverage, you would not need to worry about enrolling in a separate standalone Part D plan with Medicare. But the key to that is that the drug coverage that you have that is allowing you not to enroll in a Part D has to be what they call creditable. In order for it to be considered creditable, it has to be at least as good or better than what Medicare offers. Employers and retirement benefits are required by federal law to provide you a letter every year that tells you if the health benefits that you have includes creditable drug coverage as compared to Medicare. And everybody should get that every year, whether you're eligible for Medicare or not. Everybody gets that letter from the employer. The other thing you'd want to consider is if you purchased or enrolled and had a premium for a standalone Part D drug plan, how much that would cost you and what the copays and deductibles would be for that plan you enrolled in, especially if you compare that to other options that you may have through an employer. So the costs of the drugs, the copays, the premiums for the Part D plans. And then, as with all parts of Medicare, it is optional as to whether or not you enroll in this benefit. However, if you don't enroll in this benefit when you first become eligible and you don't have creditable drug coverage as your reason for not enrolling in this benefit when you become eligible, Medicare will allow you to enroll in this benefit any year down the road during an annual enrollment period, but you may be charged more when you enroll down the road in the form of a late enrollment penalty because you didn't have other creditable coverage in the meantime. And we will talk about that more as we go. So there are specific timeframes that you can enroll in this kind of coverage, and they're going to coincide with the enrollment periods that we've already discussed. So the initial enrollment period, which is when you are first becoming eligible for Medicare, usually at age 65, it's that 7-month period that surrounds that 65th month birthday month. So it's the 3 months prior to the month you turn 65, the month of, and up to 3 months after the month you turn 65 is a window to enroll in a Part D to coordinate with Medicare. Then there's the annual election period, or what we can typically call open enrollment, That's the October 15th through December 7th window every year. Any change you make, whether it's to enroll in, enroll out of, or to switch from one plan to another, any change you make during that time frame goes into effect in January. And then special enrollment periods are those opportunities to enroll in any coverage with Medicare based on a special situation such as loss of other creditable coverage. Any questions about any of that so far? All right. So how does it work? Well, let's talk about that penalty first. As with other parts of Medicare, if you don't enroll when you first become eligible and you don't have a good reason for not enrolling, so for example, with Medicare Part B, if you don't enroll when you turn 65, Social Security will penalize you or make you pay more in the future when you enroll, unless you are actively employed and had employer group health coverage. For Part D penalty, you still have to have a good reason for not enrolling in Part D, such as having other creditable coverage. But if you don't have that reason and you incur a penalty, it's calculated a little bit differently than Part B. Medicare Part B penalty was calculated at 10% per year for every year you delayed enrollment. For Part D purposes, it's calculated at 1% per month. But that 1% per month is calculated based on the annual national Part D premium. It's the average annual monthly premium for all Part D plans across the country. The national average Part D premium for 2025 is $36.78. It does vary state to state. So in Colorado, that would be calculated at $37.02. So for example, if you were eligible to enroll last year, say 13 months ago, you didn't, you're going to enroll this year during the annual enrollment period that starts in October to be effective in January. So you're looking at potentially 2 years, maybe 25 months, or 25% penalty because it's 1% per month. That 25% would be multiplied by that $37.02. Whatever that comes out to would be tacked on top of whatever premium for whatever plan you do choose to enroll in when you enroll. And again, penalties last forever, so that would be tacked on every month forever and ever and ever. Now, the worst part about the Part D penalty is that it changes every year. Once the percentage is determined, for in this example, 25% or 25 months, once that's determined, that stays the same. But the national average benchmark premium will change every year. And so it will be recalculated every year based on whatever that national average premium ends up as each year. So it will fluctuate every year as far as what that penalty amount is going to be. Honestly, the bottom line is that's just way too much math. And so for that reason alone, you shouldn't incur penalties if you can help it. As with other parts of Medicare, Part D benefits are also means tested, meaning if you have a significant annual income based on tax filings, you may pay higher premiums based on solely that higher income. Calculated the same way as Part B is calculated. It's the IRMA, the income related monthly adjustment amounts. So if you have, as an individual, a tax filing for the most recent complete tax filing with the IRS, which is probably going to be for 2023. If in that year your annual income was $106,000 or less, you don't have to worry about it. But if your annual income was $106,000 or more, you will have to pay more premium based solely on the higher income. Again, these IRMA amounts are recalculated annually. So if you had a really high earning year 2 years ago, you've since retired, your income is not at that amount anymore. Social Security will recalculate that every year. And so you're not going to pay that higher amount every year for B and D. It's going to be based on your annual income as it fluctuates. And the amounts extra that you would pay for Part D, as in drug, are on the slide here. Obviously, they're a little bit higher for Part B purposes. All right, so how does Part D work? Well, surprisingly, Part D has gotten simpler. In 2023, a new law was enacted that went into effect in January of this year that put a annual cap, maximum out-of-pocket amount on Part D benefits. So starting in January of this year, what used to be referred to as the donut hole or the coverage gap in Part D benefits was eliminated. Now, Part D benefits are calculated at a max out of pocket, meaning the most you will ever pay as a Part D benefit or through Part D coverage is $2,000 out of your pocket. If you have drug costs that accumulate to $2,000 out of your pocket within a calendar year or before the end of a calendar year, once you hit that $2,000 cap, the rest of the calendar year, your drugs are at no cost. And then come January 1st, it starts all over. So that is a huge, huge, huge change and a huge benefit to people who are enrolled in Part D coverage. The way it was calculated before, there was deductible, then there was initial coverage, then there was donut hole. And in the donut hole, everybody's copays at the pharmacy shot up. And then you had to hit another dollar amount before you got to the other side of the donut hole. And then you still had a copay on the other side. With the way it's calculated now, it's a flat $2,000. Once you hit that, you pay nothing for the rest of the year in copays. Although the plans do still have an annual deductible, and most of them do have the deductible, the max deductible for 2025 is $590. What that means is once you're enrolled in a plan, you have to pay out of your pocket in retail costs at the pharmacy the first $590, whether that is the equivalent of purchasing one medication or it takes you several months to purchase several medications a month. It all depends on the cost of the medications that you take. But once you have spent the first $590 in retail cost out of your pocket, then your drug plan kicks in. And the next time you go to the pharmacy, you'll pay a much lower cost, hopefully in the form of a copay. After the deductible, copays are going to be at most 25% of the retail cost of any prescription. Most Part D plans do better than that, though, especially on generics. There are lots of plans that offer zero copay generics, $25 brand name copays. So hopefully the cost that you pay as a copay is much smaller than what you were paying retail during the deductible. So you pay 25% or less, your plan pays the other 75%. Again, once you hit that $2,000 cap, then you pay zero for the rest of the year, and the plan pays 60% of the retail cost of your drugs, and Medicare pays the rest. And then again, come January, it starts all over. There are other improvements that have been made to the drug benefits of Medicare. In 2023, Medicare was able to initiate a $35 max copay for some insulins. However, the downside to that is not all plans participate with that $35 max copay. That Medicare allowed it to be voluntary. And within the plans that do participate, not all insulins are going to be covered under that $35 copay. So you really have to be sure that you make sure whatever plan you are looking at covers your specific drugs. And hopefully, if you take insulin, the plan that you look at does have that max $35 copay for that insulin. In 2024, the improvements to Part D benefits included once you hit catastrophic coverage, the catastrophic level of coverage in your Part D, you went to zero copay instead of a small copay. For people who have limited or low income, the extra help is what it's called, assistance, financial assistance for Part D benefits, increased the income and asset levels, and they eliminated levels, the different levels. So there used to be like 4 different levels you could qualify for. based on your income and assets, and that provided 4 different types of copays. That was all eliminated. Medicare applies one income limit and one asset limit, and anybody within those limits pays the same. They pay low copays, no premiums, no deductibles. Again, in 2025, we got the $2,000 max out of pocket, and Medicare has been able to start negotiating the cost of some of the higher priced drugs that are available through Medicare Part D. They were able to add 10 drugs to that list of negotiated prescription drugs. So overall, those drugs are going to cost the plans less, which means they're going to cost you less at the pharmacy. And every year for the next several years, they'll be able to negotiate an additional 10 to 15 drugs each year. So hopefully, in the long run, that is going to reduce the cost of a lot of the more expensive brand name drugs. As far as requirements for the drug plans themselves, Medicare does require that any insurance company that provides Part D drug benefits for Medicare or on Medicare's behalf, every one of those plans must cover at least 2 medications in every medical class of medication. What does that mean? That means if there are 5 different drugs on the market that are designed to treat high cholesterol, each plan has to cover only 2 of those 5. But as long as they cover at least 2 of those 5 in that class of drug, they're within Medicare rules. They can opt to cover more than that, and some classes of drug have many more drugs in that class. But 2 is the minimum. There are 6 classes of drugs that Medicare requires these plans cover any drug available on the market. Those 6 classes are going to be any and all antidepressants, antipsychotics, anticonvulsants, antiretrovirals, immunosuppressants, and anti-neoplastics, which are going to be cancer drugs. Any drug on the market has to be covered by any Part D plan in those 6 categories. Medicare also requires that these plans only cover prescription drugs that have been approved for use by the FDA, and they have been approved for their medically intended use. For example, Viagra. Viagra was created for a specific reason. It was marketed for a specific reason, but now some doctors are prescribing it for other reasons, for other medical conditions, such as high blood pressure or something like that. But because Viagra was created for a different reason, for a reason that Medicare does not cover, it is not going to be covered by Medicare Part D. So even though it can be prescribed for off-label reasons, it's not going to be covered because it was not created for those off-label reasons. Medicare also requires that these plans cover drugs and biologicals, and that does include insulin and the supplies for injecting insulin, such as the needles, the syringes, alcohol swabs, etc. And every plan must cover both brand name and generic drugs on its formulary. However, if you take a brand name drug and halfway through the year that company's patent expires and that drug can suddenly be available as a generic, I can almost guarantee you that your plan is going to require that you switch to the generic equivalent because it's going to save you money and them money. Now, if there's a medical reason you should or couldn't do that, backed up by a doctor, you could certainly appeal or request an exception to that because Medicare is not going to refuse if your doctor says you need to take a brand name drug for a specific reason, even though a generic's available or something, of that sort. Medicare does have processes in place for you to try and prove the need for you to do that. And if you can prove the need to do that with your doctor's help, then Medicare is going to tell the plan you can take the generic and or you can take the brand name and they have to pay for it. As with all parts of Medicare, there are some things that are not going to be covered under Medicare Part D. So if you are receiving medications, prescription medications under Medicare Part A or Part B. For example, if you're inpatient in a hospital and the hospital is providing you with medications, those medications are going to be paid for as part of your hospital benefit. If you are receiving cancer treatments, chemotherapy, and you have to go to a doctor's office to do that, that is going to be covered under Medicare Part B because it has to be done in a medical setting. Again, Part D will only pay for drugs that you take the prescription to the pharmacy gives you the prescription. Part D will also not typically cover anything considered over the counter. Even if it requires a prescription, if you're trying to get a prescription drug that is specifically to treat anorexia or is for fertility purposes or is for cosmetic purposes, Medicare will not pay for it under Part D. Even if it requires a prescription, if that drug is solely and specifically designed to treat cough and cold symptoms, and for example, guaifenesin or Robitussin, Medicare will not pay for that. Medicare will also not pay for most supplements, vitamins and minerals, unless they're prescribed for a specific medical condition. So if you're taking say an iron supplement because you have a specific diagnosis and that's what the iron treats is that specific diagnosis, then Medicare will pay for those things. But typically, if you're just going to the Vitamin Hut or whatever to get supplements, those are not going to be covered by Part D. All right. Any questions about any of that? Again, if you have a question, you could simply unmute and ask your question or type it into the chat. I'm not seeing any questions, so we're going to get out of here early tonight. So again, I mentioned that there is financial assistance available specifically for this benefit of Medicare. We talked about financial assistance available for help paying the Medicare A and B costs. Those benefits are applied for through the local county Department of Human Services. Financial assistance for Medicare Part D as in drug is applied for through Social Security. It's called low-income subsidy, typically just referred to as extra help. Some people will get extra help automatically when they become eligible for Medicare, and those are going to be people who are on Medicaid programs such as SSI, or they are receiving or their income is low enough to qualify. So if someone gets on Medicare, they qualify for a Medicare savings program, it automatically provides them with extra help through Social Security on the drug coverage. If you are on long-term care Medicaid, even if your income is over the limits for other programs, that also automatically provides extra help on the Medicare drug benefits. So extra help is just like any other financial assistance program, is based on income and asset limits. You do apply for this directly through Social Security, and you can do that through the Social Security website. You can do it by calling the toll-free national number for Social Security, which I have on the slide, or you're always welcome to visit us. We do help people with these applications at our office. It can be done over the phone. And if anybody wants any help with that or has any additional questions about these benefits, you're always welcome to contact us, and we are happy to talk to you about them. Income and asset limits have been significantly increased starting in 2025. And this is just a flat income and asset limit for anybody and everybody. For 2025, for an individual, you can have up to a $1,976 pre-deduction monthly income and assets up to $17,600, which does not include your home that you live in, your primary vehicle, personal possessions, and still qualify for extra help. Again, if you qualify, apply for, and are approved for extra help, that provides you with a Medicare drug benefit at no premium. It eliminates the deductible, and it does reduce the copays for your medications at the pharmacy. Generics are $4.90 or less. Brand name drugs, regardless of the retail cost, would be reduced to $12.15 or less for a 30-day supply. And again, if anybody has any questions or wants more information about these programs, just let us know. For people who might be in the in-between, your income is over those limits, but your prescription costs are still hard to navigate. There may still be assistance available through patient assistance programs from the makers of the drugs directly. What I've listed here is some of the websites that we have used to find those patient assistance programs for specific drugs. Typically, patient assistance programs are going to apply to brand name, the more expensive medications, or specialty drugs. If you're taking just all generic drugs, there's probably not going to be any patient assistance programs out there to help with those costs. But if you take any brand name drugs, because those drugs are so expensive, we could always look to see if there's a patient assistance program available if you don't qualify for the extra help. Anybody can go onto any of those websites and look for any sort of assistance that might be out there. So that's basically how Medicare drug coverage works in a nutshell. But just like with Advantage plans, there's a lot of options to choose from. A lot of things to take into consideration, such as premiums, whether or not your drugs are covered, the costs at the pharmacy, such as the copays and deductibles. Again, if you have the option of, say, employer coverage or retiree coverage, VA, those kinds of things, you may not need to worry about a drug plan with Medicare, a Medicare Part D plan, because you have coverage through another source that's just as good or better. But if Part D is something you do need to consider, there's a couple ways you can go about trying to figure out which one of those plans is going to work best for you. You can start by just calling every plan, asking them if they cover all of your specific medications, get the copays, write it all down, add it all up, include the premium, the deductible, and kind of just do it that way. That's a lot of work. You can reach out to an agent or broker, let them do the work for you, and they will present you with cost comparison results based on the plans that they might sell. Probably not going to get you a full um, list of all the plans that are available and all comparisons, all the comparison costs of all the plans available. It will most likely be more limited to what they offer. Or you can use the most effective way, which is to go to the Medicare website and use what they call the Plan Finder. Now, going to the Medicare website, as I mentioned in week 1, you are given the ability at medicare.gov to create your own personalized account. The advantages of creating a personalized account, if you put a list of your medications in there to use while you're doing a search through the plan finder to see what plan is going to be your best choice, it saves that list of drugs. So you don't have to type it in every year. It can do a search and compare. It will also be able to show you all of the claims that are submitted to Medicare from providers that you have seen in real time. So you see those claims electronically way sooner than you would see them through the mail. It has an electronic health records option that you would be able to give your medical providers access to, so that all of your medical information is centralized and they can access it, as well as other benefits. So there are a lot of benefits to creating an account. It is fairly simple to create an account. You just have to come up with a password and an ID. It is secure. It is not required. You can do anything and everything that we're talking about as far as comparisons without creating an account. And to do that, you just go to medicare.gov. This is a screenshot of the homepage. From that homepage, you simply click on the tab that says Find Health and Drug Plans. The next page it's going to show you is going to give you the option to log in because you've created an account. But for most clients that we help, we don't log in. We continue without logging in, which is to the right there. And all you have to do is put in a zip code and tell it what type of plan you want to help search with. Once you hit next on that screen, it takes you to a screen that's going to ask you if you qualify for financial assistance. You say yay or nay. It's going to ask you if you want to enter your drugs. And it gives you the ability to enter all of your very specific drugs, quantities, dosages. You pick up to 5 preferred pharmacies that you want to compare the prices at, all of those things. Once you've got all of that information in there, you've listed all your drugs, you've picked all your pharmacies, that program, that search engine is going to compare all of that information to the plans that are available in Colorado this year. And the end result is it's going to list those plans. And the plan at the top of the list is going to be the plan that would be most cost effective, basically provide you the best coverage. And at the bottom of the list, it's going to be the plan that would be least cost effective or cost you the most money to get your drugs with. And you go into each one of those plans and it gives you all the details, tells you what your copays are going to be at any pharmacy. It just gives you tons and tons and tons of information. Again, during open enrollment, we help people with looking and comparing their drug plan options based on their current prescription needs every year, hundreds and hundreds of people. And this is what we use to do that. And a lot of times people just need help interpreting those end results. And we're happy to do that. We're happy to walk through this website search engine with you so that, you kind of get that walk through the first time. Once you kind of understand what you're looking at, people just start taking it from there and do it themselves every year. Bottom line is we're happy to help in any way, whether it's just walking you through it the first time, or we have people who come back every year and want us to do this for them and just help them find their best option year to year. If anybody wants a walkthrough, just let us know. We're happy to do it. All right. So I'll take another pause to see if there's any other questions. We're almost done. So if you do have any questions, let me know. If you don't have any questions now, you're always welcome to reach out after presentation or at any time. Shoot me an email, give us a call. We're happy to answer any questions at any time. So other resources for this information, I mentioned a couple weeks ago, the Medicare and You Handbook. When you are looking at the Medicare and You Handbook, because you can go to the Medicare.gov website and get the handbook and download it as a PDF. But that's just going to be general information. It's not going to be state specific. If you get a hard copy state specific Medicare and You Handbook, all of the Advantage plans, all the drug plans are listed in the back of that book. You can go to the Medicare.gov website, which we just kind of glanced at. You can always call 1-800-Medicare. There are people available to answer the phone at 1-800-Medicare 24 hours a day, 7 days a week, 365 days a year. And if you're worried about waiting on hold, the later you call in the evening, the quicker you're going to get through. If you call them at 2 o'clock in the morning when you get up to go to the bathroom, they're going to be dying to talk to somebody to make the night go by. So you are always able to contact Medicare directly, or you can always call your local SHIP office, and we're always happy to help. Again, I'm going to mention that our sister program, Senior Medicare Patrol, is a companion program to the SHIP program that helps educate and empower people to identify fraud, abuse, and errors. If anybody wants any information about that program, or if you have any concerns that you may be having an issue, you're getting a bill that you don't think you should be getting, you're finding services listed on your Medicare insurance explanations that don't look familiar, anything like that, you're always welcome to bring it to us and we'll help figure out what's going on. If you're getting phone calls or you accidentally gave someone your information and you're not sure who it really was, give us a call. We'll help you figure it out, figure out what you can do about it. Colorado does have a statewide hotline. There is a national website for that program as well. For both of these programs, we're always looking for volunteers if anybody's interested. It's a lot of information to learn, but it is very rewarding. And that's basically all I have for you tonight. Our contact information, again, if you have any questions, you can always shoot me an email. You can give us a call. We're always happy to help. And I think that's all I have for you guys tonight. I'll get you out of here early. Any questions before I let you all go? All right. I'm still not seeing any. I'm not hearing any. Hopefully you will join me for our last presentation, week 4, part 4 of 4, where we're going to kind of go over any and all kinds of insurance that can coordinate with Medicare, such as retirement plans, military retirees, uh, Medicaid, COBRA, all of those kinds of things. That's also a short and sweet class. As always, I will email the handouts for any of our classes prior to the class starting. And other than that, thank you very much for joining me. Thank you for your interest in this class. Please feel free to fill out the survey, and we appreciate getting those back because it really does help our funding. If you have any questions, please reach out to us, and hopefully I'll see you all next week.